Hello everyone, and welcome, welcome to this audio podcast. This audio podcast as part of the as part of the Real Shizmode. This audio podcast as part of the Shitstorm and Molecule. This audio podcast as part of the Bedlam and Storm, and this audio podcast as part of the AHA 2026 and a ZtormLabostix production. Through this audio podcast today, looking at in around the AHA nomination under the category in around the category for the best collaboration across clinical, academia, and industry. And in around this in around this nomination, or in around this category, there is the nomination is in around the efforts, or some of the efforts in around the RPSG KDARs Group for Kids, and with ZtormLabostix Productions. So as part of this category, or this and around this in the basis of this remit, the basis is where there be whether questions, and then in part of the questions there will be sort of the responses, and the responses are the basis of the in around the responses to the particular question. So the first question in around this works to do with the nomination and category, again to do with the in around the basis for the best collaboration across clinical, academia, and industry, is where there is the question summarize the project or initiative and its significance and impact. So the response in around this is encouraging and inspiring and all healthcare professionals is where there have been focused efforts, and through the RPSG and KDARs Group for Kids and ZtormLabostix Productions, where an effort has been to encourage evidence-based collaborations between laboratory medicine, academia, and research to enhance patient care. Addition, one of the secondary question is provide a sort of provide or offer fuller description of the around the innovation aspect of innovation, and how partnership devised and implemented it. So as part of the response, patients and carers often have various questions relating to kidney care following routine clinical appointments. The RPSG and KDAR social media platforms that linked evidence-based social media platforms that linked evidence-based and scientific practices to support adults and pediatrics and young people suffering with varying forms of kidney disease. So with a collaboration with ZtormLabostix Productions, there have been efforts that highlight themes and topics through audios and podcasts across the sciences to encourage healthcare service users and providers to learn and co-develop best practices. The idea has been to see that there is a bridge between patient care and healthcare service provision through education between healthcare sectors, and the audio podcast channel as part of the audio podcast channel and the social media platforms. So the collaborative effort has looked to bridge an important gap that requires more established educational and support pathways built into healthcare and the sciences, including kidney care, safeguarding confidentiality and security between the social media platforms, and highlighting important topics across ZtormLabostix Productions for academics, researchers, students, and others has been extremely pertinent or important to objectives and mission. So, additionally, one of the third questions in as part of this category is what are the measures or measurable outcomes and advantages in terms of patient services. So between the two as part of the response, then between the two social media platforms, there have been vibrant online communities that have wanted to drive to integrate kidney care awareness and research with an ethos surrounding evidence-based medicine and healthcare evidence-based medicine and healthcare with scientific practices. The RPSG and KDARs portfolio highlights evidence-based practices between frontline and allied healthcare professionals, and where the focus to enhance patient services has surrounding health education, thus to increase healthcare language and literacy. The RPSG and KDARs platforms have historically been represented so that varying project outcomes surrounding awareness and research outcomes are disseminated in public domain in public domain. And the main advantages of RPSG and KDARs collaboration is that kidney care and pathology services for pediatrics and young people and adults has become corroborated by ZtormLabostix Productions, highlighting essential that interconnect international effort now approaching over 2 decades. So another question in as part of this category is why was this collaboration the right one to tackle the problem or develop the innovation? As part of the response is the RPSG and KDARs in collaboration with ZtormLabostix Productions has and across with ZtormLabostix Productions and across have been inspirational because efforts have sought to join up science, factoring in a kidney themed healthcare topics, but also across the sciences. Additionally, there have been important healthcare sciences position and strong focus on encouraging joined up thinking to drive practice excellence. The collaborative efforts between social media platforms and audio podcast channel continue to be successful owing to putting patients first and commitment to scientific healthcare practices. The RPSG and KDARs social media platforms and ZtormLabostix Productions also continue to challenge healthcare disparities in the public domain. As part of another question, one of the other questions in this category is how have healthcare service users and communities been involved? And in response to this, the response to this is between the two social media platforms, there is and are patient-focused founders and co-founders, administration and moderating teams, which have historically encouraged and supported healthcare service users. ZtormLabostix Productions has aligned efforts that highlight topics in science with patient care. With this, there have been a science focus prompt to encourage patient and healthcare professionals inclusion to work together in meeting mutual objectives regarding scientific practices, primarily linked to the National Institute of Healthcare Research, NIHR involvement framework, and additionally toward the National Institute of Care and Excellence, or NICE practices. Again, many RPSG and KDARs projects have recognized the importance of healthcare service users across collaborations. The RPSG and KDARs are platforms, are social media platforms for all. In as part of the Another question in this category is how could it be sustained, and what is the potential for transferability and scalability across organizations or services? And around the response to this question, the RPSG and KDARs and ZtormLabostix Productions have ensured there are several social media platforms utilized to integrate patient care and a continuing ethos surrounding involving healthcare professionals, undergraduate and postgraduate students, academics and researchers to improve evidence-based practices surrounding topics across the sciences and kidney care. Both RPSG and KDARs have patient and public involvement or PPI-led efforts in keeping with NIHR to support practice excellence. The NIHR framework continues to be a guide and a commitment to patient care. This makes the collaborations transferable and scalable across organizations and all services. In around one of the final questions in this category is one of the final questions actually leads into who are those that have been involved in this in as part of the collaborative efforts, and as part of this collaborative efforts as part of this particular theme. And so for the purposes of that, the response to that, the response will be anonymized in context of this audio, audio podcast, but there will be information in context of information on social media, as part of a basis of acknowledgement in as part of this audio podcast recording. So that draws this audio podcast to a close. This audio podcast is part of the Real Shitmode. This audio podcast is part of the Shitstorm and Molecule. This audio podcast is part of the Bedlam and Storm. This audio podcast is part of the AHA 2026. And this audio podcast is part of a ZtormLabostix production.